Kia whānau, welcome back to another Women's Health Action Trust COVID-19 Digi Update. It's Caitlin here again, our Digital Media Health Promotion Coordinator, and today I have a similar video to how I've been doing the past couple, just basically reading the Ministry of Health information, and today we're going to be looking at their advice for older people. So if you hadn't had a chance to read the info yourself, feel free to just listen podcast style. There's some really good information here for managing life under level 4. Now, as some of you are anticipating, we may be moving to level 3, although life is probably going to look fairly similar under level 3 for those of us who are older or at risk. So this advice is probably still pretty valid under level 3 too. So we've got some advice for kind of just managing daily life, and also some advice from the government on having a safe bubble. So feel free to listen if you haven't had a chance to read this yourself. And if you do want to have a look for yourself, it'll be linked and you can check that out. So COVID-19 advice for older people. Older people often have underlying health issues, including respiratory issues that make them more vulnerable to COVID-19, so it is especially important to follow the rules. At Alert Level 4, you will be able to stay in your usual home with your family or housemates and get essential things you need, such as groceries or prescriptions. Supermarkets and pharmacies will remain open, but non-urgent health services might be cancelled to ensure healthcare workers can help where they are most needed. If you do visit the supermarket, keep 2 metres apart from other people and follow good hygiene rules, including washing your hands and covering your mouth or sneezing into your elbow. We also encourage anyone under 70 living with you to practice a spirit of manaakitanga and run these errands for you. If you need a prescription, you can call your doctor and they will advise you if you should pick it up from the pharmacy or if it can be delivered to your doorstep. Now's the time to reach out to friends, families and neighbours for help if you need it. Cafes and restaurants and bars will be closed while we remain in Alert Level 4. Right now, the most important thing you can do is avoid contracting COVID-19. This means being careful, clean and making a plan. Don't be scared, be prepared. They've also got some advice here on how to create a safe bubble. So this is advice for creating a support/bubble buddy during Alert Level 4 for older people who live alone or who live in a retirement village. Under Alert Level 4, people are required to self-isolate and remain in their bubble. Your bubble will keep you safe, in contact with family and friends, and help you reduce the chance of people becoming isolated or lonely. For people living alone, bubbles may include a person outside of their home. To prevent the spread of COVID-19, extra precautions will need to be taken. Older people often have underlying health issues, including respiratory issues, that make them more vulnerable to COVID-19, so it is especially important to follow advice. Older people who live alone can create a bubble with someone else who also lives alone. If they live in a retirement village, their bubble buddy must live in the same retirement village. Older people who live alone can create a buddy with someone else who also lives alone, provided that they avoid face-to-face contact with anyone outside their bubble. They keep a safe distance as much as possible. They avoid shaking hands, kissing or hugging. They avoid contact with their buddy if they have a cold or flu-like illness. They live in the same community or live in the same retirement village. For the duration of Alert Level 4, no additional people can be included in the bubble. They do not have any underlying health conditions that bring them into contact with other people outside the bubble. Meticulous attention to basic hygiene measures is essential to prevent the spread of COVID-19. In addition, for those living in a retirement village, consideration should be given to who is already in the bubble, for example your meal or laundry service, including services from outside the village. And people who are planning to share their bubble must engage the retirement village management in their plans so a risk assessment and plan can be made together. Now remember, you must wash your hands regularly for at least 20 seconds using soap and water. This is especially important after using the bathroom, coughing, sneezing, blowing your nose, getting home, eating or preparing food, and you should be drying your hands too. Avoid touching your nose, mouth or eyes unless you've washed your hands. Stay away from sneezes. 2 metres is a safe distance to stay away from anybody sneezing. This is about the length of your couch or bed. Cover your cough. If you need to cough or sneeze, cover your nose or mouth with your bent elbow or a tissue, then throw it in the bin. If you feel at all unwell, make sure you stay at home until you feel better and try to stay in a separate room from the people you live with. Find the facts. Lots of people are talking about COVID-19 right now. It can be confusing when lots of people are saying different things. Make sure you get your information from official sources like the Ministry of Health and the COVID-19 website. If people tell you new information, ask where they got it from, and make sure it's official. Keep up to date with facts, not rumours. Manage your mental well-being. Reach out to your family and whānau, friends and workmates. Sharing how we feel and offering support to others is important. We also recommend sticking to a routine, such as having regular meal times, bedtimes, and exercising. Tell yourself that how you are feeling is a normal reaction and it will pass. It's nothing to be afraid of. If you feel you're not coping, it's important to talk with a health professional. Call your regular healthcare provider for support with grief, anxiety, distress, or mental well-being. You can also text 1737 free anytime, 24 hours a day, 7 times a week to talk with a trained counsellor. And if you're not sure who to contact for help, you can call the free government helpline on 0800 779 997, and that's operating from 8 a.m. till 1 a.m. 7 days a week. And remember, if you are feeling unwell, call your GP before you visit or call Healthline on 0800 358 5453. More information can be found on the Ministry of Health website. So that's what the Ministry of Health has got out at the moment for advice for people who are older. So just sort of some advice there on hygiene, which I'm sure we've all heard a lot by now, and also some information on bubbles and potentially expanding your bubble if you are alone. We know from our survey that we did on people over the age of 60 that around 40% of people who answered that survey were living alone. So I'll link the PDF that the government has put out on that, on expanding your bubble if you live alone, because that could be definitely something to consider. Now, if you are over 60, we've got another video coming up very shortly with somebody from Age Concern, and that's awesome. We talked about some great coping techniques, more services you can access, so that'll be posted soon. In the meantime, stay safe in your bubble, and we will see you in our next Digi update. Thanks for watching.